Good afternoon, and welcome to Day 2 of Catalyst Miami's Poverty Solutions Summit. My name is Natalie Castellanos. I am the Director of Policy and Public Affairs with the Health Foundation of South Florida. We are South Florida's largest not-for-profit grant-making organization dedicated solely to health. I'm honored to be here today moderating this panel, Strategies to Increase Access to Healthcare. This is the third Poverty Solutions Summit that I've attended, and I have to say that despite the fact that we are virtual this year, it still feels like I'm returning home to something special for a family reunion or one of my abuela's home-cooked meals. Maybe those of you who have attended in the past feel the same way. I want to acknowledge Catalyst Miami for creating these nurturing, engaging spaces where we can learn, be inspired, and return home to refocus on our shared mission of serving community. And for those of you who are here for the first time, welcome to the family. For the next hour, we will be hearing directly from two individuals on the front lines advancing strategies to increase healthcare. Alison Yager is an attorney with over 20 years of experience advocating on behalf of women, children, and marginalized individuals. She is currently the Deputy Executive Director at the Florida Health Justice Project based here in Miami, where she engages in a range of advocacy strategies to expand healthcare access and promote health equity for vulnerable Floridians. We will later be joined by Cecelia Belser-Patton. She is an educator, an organizer, and professional development facilitator. She serves as the principal and culture curator of Just Systems. It's a capacity building and sustainability consulting firm that specializes in restorative practices, including diversity, inclusion, and equity development. She has also been active in political campaigns, including serving as the Inclusion and Equity Director for Healthcare for Missouri, otherwise known as the Missouri Medicaid Expansion campaign. And fun fact, she is also a professional thespian. We'll start our panel today by hearing directly from Alison and Cecelia, and then we are reserving time at the end for audience Q&A. So we'll have 15 minutes. So please feel free to drop your questions, comments, and reflections into the chat, and we will do our best to get to as many of them at the end. And with that, Alison, we know a lack of affordable health care is a serious barrier to health equity. Can you tell us about strategies or policies that can be implemented, that are being worked on to increase access to affordable health care here in Miami-Dade County, but also across our state, Florida?
Yeah. So thank you so much, Natalie. I am really excited to be here with you and Cecelia and all of you who have joined us today. This is my first Poverty Summit, and I am thrilled to be a part of it. Everything Catalyst Miami does is really extraordinary, and Catalyst serves as such an important institution in the community. So I am honored to be here. So I want to start by telling briefly the story of someone who happens to also be named Alison. Alison is someone who shared her story with us at Florida Health Justice Project as part of an effort of ours where we turn health policy issues into really understandable stories of people's lives and the way in which health policy impacts people. So Alison works as a part-time cashier at a Winn-Dixie. She takes care of her 20-year-old son who is developmentally disabled. And when her youngest child turned 18, she lost her Medicaid coverage. So like many low-wage and part-time workers, she doesn't have insurance through her employer. And because her earnings are below the federal poverty level, she's not eligible for a subsidy to purchase Affordable Care Act insurance through the marketplace. So as a result, Alison is uninsured, and she's not able to access medication that she really needs for two conditions, both high blood pressure and depression. And we know that Alison is not alone. There are so many people in this situation, maybe some of us who are here on this panel today, on this call today. So Natalie, I know we're talking about solutions, but I also want to just back up by talking about what is the dire state of affairs here in Florida before we get a bit to what can be done about it. Because I think in order to appreciate how desperately needed the solutions are, we need to fully grasp how horrific the situation is right now. So backing it up, let's talk about how many people like Alison are out there. Who are these folks? What's the impact of not having health insurance on their lives? So a huge number of Floridians don't have health insurance. Pre-pandemic, almost 2.5 million Floridians between the ages of 19 and 64 lacked health insurance. That was pre-pandemic, before we lost hundreds of thousands of jobs and employer-sponsored health insurance alongside that. So given that 2.5 million Floridians, it's not going to surprise folks to hear that Florida is tied with Mississippi for third place among the states for the highest rate of uninsured non-elderly adults. That is not a distinction that we want to bear. That's not the medal that we want to be wearing. So we know also that the burden of being uninsured, like virtually all injustices in this country, is not spread evenly. Residents of color in Florida are feeling this injustice most profoundly. A full 21% of Florida's Latino residents, more than 1 out of every 5, lack health insurance. And 17% of Black residents in Florida lack health insurance. That's compared to 13% of white residents who lack health insurance. So this lack of insurance is not spread evenly. And likely as a result of this lack of coverage, just 58%, less than 60% of Latinos in Miami-Dade have someone who they consider to be their doctor or their healthcare provider. If you don't have a doctor, you're not going to the doctor. And when you need to go to the doctor, you're likely going to the emergency room. And that's going to only happen in an emergency. You're not getting preventive care. You're not taking care of chronic conditions. So that's kind of the state of affairs in Florida. We know that when folks don't have health insurance, as I just said, accessing care becomes a problem. And it becomes a problem in large part because of the phenomenally high costs of care in this country. So too many Floridians can't afford health care if they don't have insurance. And as a result, like I just said, they don't receive care or they end up straddled with healthcare debt. So I'm going to give a couple more data points because I think the numbers say a lot. And I know sometimes it's hard to hear numbers, but I'll try and speak slowly and repeat myself because the numbers really are pretty shocking. So a couple of years ago, there was a survey done of adults in Florida, and over half of those folks said that they experienced burdensome healthcare costs. That could be healthcare debt or just the inability to pay for healthcare. And more than 3/4 of people said that they were worried about affording healthcare in the future. And again, this was all pre-pandemic, before we had hundreds of thousands of people losing jobs and losing employer-sponsored health insurance. So because people can't afford care, they're not getting care, they're not getting medication, they're not getting treatment. And some specifics along those lines, 20% of Floridians, a full 1/5, avoided going to the doctor or having a procedure done because of high care costs. Also, nearly 1/5 failed to fill a prescription, weren't able to fill a prescription that a doctor or a nurse had given them because they needed this medication, but they had to forego the medication because of costs. So people are losing out on critical care because too many people aren't insured. And just to finish drawing out this picture of the impact of the unacceptably high rates of uninsurance, let's talk a little bit about disparities in health outcomes, not just disparities in coverage, but outcomes. Because the fact is, when we look at a given health outcome, let's say heart disease, for instance, we see that Black residents and sometimes Hispanic residents are faring far worse than white residents. And this is a pattern that is true for virtually any health indicator you could choose. And it's true in part because of who has access to care. So let me give a few examples. And I know these are painful statistics to hear. In Miami-Dade County, Black men are more than twice as likely as white men to die from prostate cancer. In Florida, Black mamas are nearly 3 times as likely to experience a pregnancy-related death as white mamas. And Black Floridians are 2.5 times as likely to die from diabetes as white Floridians. And unfortunately, we could keep going with this list, but let's not. We get the idea, and we know that this is a travesty. This is an injustice, and this is an injustice that demands urgent action, which is why we're having this conversation. And so let's get back to where you started, Natalie, about what can be done. So let's talk a little bit about Medicaid. I know, I'm sure there are a lot of different folks with different experiences on this, in this conversation. So just to do some level setting, Medicaid is a public health insurance program that has for decades provided coverage to millions of low-income individuals and families across the country. Now, many of us remember when President Obama passed the Affordable Care Act, and one piece of that legislation was that Medicaid was to be expanded to cover all adults between the ages of 19, when people become an adult, up to 65. And specifically folks who are living at up to 138% of the federal poverty level. So the idea was all non-senior adults up to 138% of poverty should have access to the Medicaid health coverage program. But not all states were equally committed to this idea of health justice. And in fact, some states were so against the idea that they sued the federal government. And in 2012, the United States Supreme Court heard the case and decided that no, the federal government could not force states to expand their Medicaid program. States had to choose to do so on their own. So now, 9 years later, Florida is currently one of just 12 states, the majority of whom are in the South, the majority of which are in the South, that have not expanded Medicaid. And this is leaving us with large numbers of low-income residents who don't have health coverage, the folks we were just talking about a minute ago. And expanding Medicaid is a central strategy to improving health outcomes and lowering costs for uninsured Floridians. Now, again, I keep mentioning pre-pandemic and post-pandemic. In June, well, we're not post-pandemic yet, but in June of 2020, when we had seen millions of jobs shed around the country, researchers took a look at how many people they anticipated would benefit from Medicaid expansion. And they found that an estimated 1.5 million Floridians would now benefit from Medicaid expansion. That includes the folks who have lost access to health coverage since March, when jobs started being shed so rapidly. And there's a lot of research that's looked at what's happened in the states that did expand Medicaid. Did it work? Did it succeed in covering folks? Are those folks doing better? Are health outcomes improved as a result of Medicaid expansion? Are disparities down as a result of Medicaid expansion? And the answer to all of those questions is yes. Medicaid expansion really works. It gets people covered, it improves health outcomes, it decreases disparities. So breaking some of that down a little bit, Medicaid expansion increases coverage. In the first few years of the Affordable Care Act, the first 4 years, Medicaid enrollment was up 17 percentage points among low-income adults in expansion states as compared to non-expansion states. In fact, Ohio, a state that expanded Medicaid, looked at how had expansion risen in their state, and they found that Medicaid expansion cut the uninsured rate among low-income adults in their state by 60%. So can you imagine if Florida could decrease our uninsurance rate by 60%, how many people would benefit from that right now? So we also have seen that people who've become newly covered in states that expanded Medicaid are now far more likely to get the medical care that they need. Study after study shows that in states that have expanded Medicaid, people have better access to care and medication. So what does that mean specifically? You remember a minute ago, I mentioned that just 58% of Hispanics in Miami-Dade have someone they think of as their doctor or their healthcare provider. Well, Medicaid expansion is associated with increasing the probability that you have a doctor. So Medicaid expansion works. Remember when I said that more than half of Floridians experienced burdensome healthcare costs? Well, Medicaid expansion is associated with a decreased likelihood of not seeing a doctor because of cost. And researchers have also found that Medicaid expansion is associated to just increasing access to the care and the treatment that people need, specifically things like increasing access to and utilization of cancer surgery, medication for treating diabetes, for treating cardiovascular disease, for mental health conditions, tobacco cessation, for getting people birth control, for access to mental health services. And let's also turn back to this issue of disparities that's so critical. Medicaid expansion is associated with decreasing disparities in access to and use of healthcare by race and ethnicity, as well as income. In other words, Medicaid expansion helps to level the playing field a bit. In the first 4 years of the Affordable Care Act, in the first 4 years of the Medicaid expansion rollout, as well as access to the marketplaces, all racial and ethnic groups saw gains in health coverage. That was the point of the Affordable Care Act. But the states that expanded Medicaid were able to bring the difference in coverage rates between white residents and Black residents from 10 percentage points down to 3 percentage points. In other words, you had this big gap before Medicaid expansion in what percentage of folks actually had health coverage. And with Medicaid expansion, we practically eliminated that gap. So Medicaid expansion is really key to turning the tide on disparities. So all of that is to say, Florida needs Medicaid expansion, and we are working on this. We're working at Florida Health Justice Project, we're working in coalition with so many amazing groups around the state, including Catalyst Miami, an effort that's being led by partners at Florida Voices for Health. We have 3 bills in the legislature right now that would expand Medicaid. And let me say, we've had these bills in the legislature year after year, and unfortunately, our legislature hasn't been able to pass Medicaid expansion. There's a lot of resistance for economic reasons. And so the bills have been repeatedly voted down or killed. At the same time, I will say pressure is mounting. 2020 was a year unlike any other. And so the landscape has changed a little bit. But we are working all fronts to try and get a Medicaid expansion bill passed, which is how many states did get Medicaid expansion. At the same time, we're following the lead of some of our sister states that have managed to get Medicaid expansion through a ballot initiative. And Cecelia, who is going to be joining us shortly, is going to be talking about their success in Missouri getting a ballot initiative passed. So we in Florida are working on a ballot initiative that would allow voters to decide on the issue of Medicaid expansion. If this isn't something that our legislators will do for us, then let's let the people decide. The ballot initiative is currently being held up at the state Supreme Court. It's a long process that if folks are curious about, we can get into in the questions, but I'm not going to get into the details now. But all to say, we are pushing forward on, hopefully for 2020, getting that on the ballot. And like I said, excited to hear Cecelia talk about what happened in Missouri. I do want to mention one more strategy, and then I will pass the baton. One more strategy that some of us are working on while waiting on Medicaid expansion. So currently, most uninsured individuals receive their medical care either through our public hospital systems or our public health clinics. But these systems really lack the resources to adequately meet the needs of all of our uninsured residents. And let me say, if we were to expand Medicaid, that would be a huge source of income for these systems. But because they're underfunded, too often they're forced to charge co-pays to their patients that are really out of reach. Someone who's sitting in a government office deciding the fee scale may think that $50 is not going to be a big deal. But when every dollar in your monthly budget is accounted for, and suddenly you're expected to pay a $50 copay for a medical visit, there's a significant likelihood that you'll either skip the medical visit, or you're going to have to give up on some of your food for that month, or utilities. You might not be able to pay the rent or get what your kids need for school that month. So these co-pays at Jackson, at our Jackson Health System and at our clinics can be prohibitively high. And I will say, we in Miami are so lucky to have the Jackson healthcare system. Not every place has a system as robust as ours for people who are uninsured, and yet Jackson doesn't get all the resources it needs. So they make up that difference by charging fees to their patients. So we at Florida Health Justice Project and Catalyst, and again, other allies around the state, or particularly in Miami-Dade, are working now on an initiative to try and bring down copays at Jackson so that no one has to make the choice about, do I go and pay this $30 copay or this $70 copay and give up groceries, or do I just give up the medical appointment altogether? So those are some of the strategies that are in the pipeline right now, and I think I'll stop there and pass it back to you, Natalie. Thank you.
Thank you, Alison. That was a really thorough summary of all of the work that you're doing, and especially setting the context for what are the needs here in Florida, and some really compelling and actually devastating data around the racial health disparities. I see a few questions that I think intersect nicely with what you were sharing, so I actually want to entertain those. So I see a question from Gustavo about the population that doesn't have legal status, so immigrants who are uninsured. How are they accounted for? I know you were just alluding to the Jackson Health System and our safety net. Can you talk about, when we're thinking about advocating for Medicaid expansion, how are you still considering the uninsured immigrant population?
Yeah, that's a great question. So very frustratingly, Medicaid does not offer services to the undocumented except in the case of what's called emergency Medicaid. But general coverage does not offer, it's not possible for undocumented folks to get regular Medicaid. There are certain immigration-based eligibility criteria. So, Gustavo, maybe you already knew that, which is the basis for your question. So really that leaves folks who are undocumented dependent on, like we said, the public hospitals and the public health clinics, which is why this issue of costs that can be prohibitive is so critical, because if Jackson or your local clinic is your only option for care, then we've really got to be taking into account the fact that we can't have any cost barriers standing in the way of an undocumented person and the care that they need. So the copay advocacy work is, in large part would benefit undocumented residents, as well as everyone who depends on Jackson for care.
Thank you, Alison. I think Cecelia, I see her in the room virtually, but I'm not sure if we can see her yet projected on. I know there's sometimes tech issues, so I'm going to give that a couple minutes, and I'm going to feed you a couple questions, Alison, while we get the tech stuff figured out. And I want to acknowledge David Peary is dropping some great comments just about, one, the billions of dollars that are left on the table when our legislature is not expanding Medicaid. Do you want to talk about, maybe elaborate on some of those technical points and those financial points that I know as advocates we focus so much on the communities that we serve, and a lot of times the decision makers are going to be more moved by the data. So can you talk about, what do we know about not only the billions of dollars left on the table, but how much is it costing our taxpayers? Do we know data around that?
Yeah, so those are great questions, and I'm glad folks are thinking about that. So we know a lot about the money side, and like you said, Natalie, our principal motivation in this work is the justice for our residents, but folks who are making decisions in state capitals are often thinking about dollars and cents and balancing budgets. So while we often hear from our legislators that we can't afford Medicaid expansion, in fact, the opposite is really true. We can't afford not to expand Medicaid. And we're paying for our failure to expand Medicaid in so many ways right now. We're paying for it with all the people who are sick, with all the people who are using emergency rooms, and literally with dollars that are left on the table. So this is a little wonky, but Medicaid is a program that's paid for by both the federal government and the states. And the federal government has a certain percentage that they chip in to cover the program costs. Right now in Florida, the federal government pays a little more than 60% of our Medicaid costs. If we were to expand Medicaid, the federal government would pay for 90% of our expansion population. So that's just 10% of the costs that Florida's left with, for so many gains in terms of financial. So let me tick through, we can think about these gains like at the individual level, at the state economy level, and we can also think about it in terms of the labor market and the way an infusion of money from the federal government really spurs the labor market. So clearly Medicaid expansion is going to be associated with improving financial outcomes for the beneficiaries of Medicaid expansion, because if you're not paying for those exorbitant healthcare costs, then you have more money to pay for food or clothes or the things that your family needs. So Medicaid expansion has allowed individuals to open up their budgets a little bit, experience less difficulty paying for care, worry less about covering medical bills, less medical debt. But at the state level, Medicaid expansion has really shown itself in places that have expanded Medicaid to be good for the state economy. And it's been estimated that expanding Medicaid would save more than $900 million over 5 years. So that's a lot of money. Louisiana found that in 1 year of Medicaid expansion, fiscal year 2017, the state saved nearly $200 million. Pennsylvania found that Medicaid expansion led to an increase in their state tax revenues because of people spending more money, that they had more in their wallets to spend. An increase in state tax revenues of $53 million. And also, as more money comes into the healthcare sector, hospitals and healthcare systems are able to hire more people. So, hospitals now are spending a lot of their own money on what's called charity care. If someone comes in and can't pay for their care and they don't have health insurance, then hospitals are required to spend a certain amount of their own budget on charity care. With so many more people covered by Medicaid expansion, the hospital now gets a reimbursement would now get a reimbursement from the Medicaid system for those costs. And with those extra dollars, hospitals and clinics can then go and hire more people. So Pennsylvania also found that they increased jobs in the healthcare sector by over 15,000 people. So that's a lot of people we could be putting to work right now in a moment when we desperately need people to be working. And then one more thing on that labor market issue. So Medicaid expansion has been shown to really sort of boost participation in the job market. Ohio, where they expanded Medicaid, found that more than 4/5 of Medicaid beneficiaries who were working reported that having health coverage made it easier for them to work. Because if you're able to go to the doctor when you're sick, then you're able to keep working. If you're not, maybe you have to leave your job because you have a condition that's really spiraling out of control. And they also found in Ohio that among their covered Medicaid population, with expansion, nearly 2/3 of Medicaid recipients who were unemployed said that having coverage made it a lot easier for them to search for a job. So when you have healthcare, you can participate in the labor market. So there's so many different ways in which this kind of spreads out across the economy, benefiting individuals, families, and the state and the state's own budget.
Thanks, Allison. I don't think I see Cecelia yet, so I'm gonna also ask another question from David Tyson. Speaking about action, is there a way for volunteers to get involved with collecting signatures for Medicaid expansion on the ballot? And let's talk about the coalition. And I also want to interject. I think I also saw Myra above make a shout out for one of the coalitions here in Miami-Dade, which is the Consortium for a Healthier Miami-Dade, which is led by the Florida Department of Health. So I just want to acknowledge that coalitions are often a really good place to go and just get on an email listserv and show up for virtual meetings. So one would be through the Consortium for a Healthier Miami-Dade, but also the Florida Voices for Health Coalition. David Tyson, I will shout out to them as well. But Allison, if I could turn it to you to give us a summary of how folks can get involved, what is needed right now, if you have any updates on that.
Yeah, so the signature gathering is a really interesting question. I love that people are thinking along those lines. So this, I said before, I was going to try not to get too much into the weeds on the state of affairs with the ballot initiative and the courts, but you're kind of prompting me to do so. So essentially, we're waiting to see whether the number of signatures that we have is going to be considered enough. You might remember that a few years ago, the state passed, the voters passed a ballot initiative to restore the rights to vote for folks who had a felony conviction. That was an incredible win. After that, there was a little bit of backlash, And the state legislature voted to make it more difficult to pass ballot initiatives. And what they did was they not only increased the number of signatures that you had to have in order to get a ballot on, get an initiative onto the ballot, you also had to collect signatures in more counties. So now, because we had our ballot initiative all teed up and ready to go, and we'd submitted it to the Supreme Court for just review of the ballot language, which is a standard part of the process. And then this law was passed, basically making it harder to get ballot initiatives on the ballot. We're now waiting to see, does that new, do those new requirements about the numbers of signatures necessary and the counties in which signatures need to be gathered, are those going to be applied to our initiative retroactively, or can we are we good with what we had already done? So we don't know the answer to that yet. If it turns out that the Supreme Court decides this legislation does apply to our initiative retroactively, we are going to be needing to gather a whole lot more signatures. And at that point, I think there will be a big effort to reach out to folks who want to participate in that. The lead organization on that, as Natalie mentioned, is a group called Florida Voices for Health. Though I don't know, Nat, if you can pull up their website. I believe is it Healthy Flock? Can you tell me what it is? It
is healthcareforflorida.org, and I just dropped it in the chat box.
Perfect. Thank you. So healthcareforflorida.org. And there is a something you can sign on to. It's to get involved in the campaign. Another way that we're really asking for folks to get involved, I started by telling the story of Alison in Miami Gardens. Another thing that we're doing, Florida Voices for Health is doing this, we're doing this, is collecting stories, because stories are such a powerful way of communicating the importance of an issue. You know, I gave a lot of details, a lot of statistics, because I think we all care about that, but a lot of times it's easy to, you know, for people's eyes to glaze over with the data. When you talk about someone's life, it's a lot harder to ignore that. And so if you are someone who has a story that you want to share and are willing to have your story up on our website, on Florida Voices for Health website, to talk to legislators and others who care about, you know, how has this impacted me personally? How would Medicaid expansion change my life? How has being uninsured impacted my life, my family? Those are such important ways that people can get involved. Or if you're a service provider and you work with clients or community members who have stories to share, if you want to be a part of urging them to share their stories. And you know, this Alison who shared her story with us, she spoke at a press conference that we held where Daniela Levine Cava was there before she became mayor. And so, you know, our storytellers are not just folks who, you know, who share their stories and then live on our website and then disappear. These are voices who are really critical to the advocacy, people who we want to be out front and center in the work. And so if you see yourself as that kind of person, please get in touch. You can also just get in touch with me directly. Natalie, I don't know if you can drop my email in the chat, but it's Yager, Y-A-G-E-R, at floridahealthjustice.org. So, you know, we would love to hear from you. If you're a provider and you want to tell your story, we've started taking videos from providers talking about the ways in which they're seeing their patients or their clients impacted by non-expansion. So there's so many people who have a story to tell, and that's really powerful, so that when we go to the legislature, we can say, you know, we get it, budgets are critical, but so are Floridians' lives.
Thanks, Alison. You know, on a personal level, I remember when in 2012, the Supreme Court issued their decision on the constitutionality of the Affordable Care Act. I mean, I remember where I was. It was like one of those moments for me. And your colleague, Miriam Harmatz from Florida Health Justice Project, was just reinforcing like how momentous that decision was, one, to uphold the constitutionality, but also what did this mean to make Medicaid expansion optional? And that was 9 years ago. I have a lot more gray hair, but you know, a lot of us who back then were looking at the issue and thinking about ways to start elevating education and just consciousness around it, I think are still here and supporting. And so it's always good to see new people and to see this as a continuing conversation. Could you comment? Because I think one thing, it's always helpful to understand like larger historical context. A lot of times states balk at expanding these programs. And so it's instructive. I don't know if you have that quick talking point that Miriam sometimes shares about when the initial Medicaid program was proposed in the 60s, how long it took the last state. Do you remember this?
I believe it took 17 years for every state to adopt Medicaid. We're not talking about expansion. We're talking about when Medicaid first came on the scene. And as there still is today, there was conversation about should we be having these social safety net programs. It took more than a decade and a half for every program to say, yeah, this is right. And now Medicaid is such an integral part of our system. I mean, people also don't think about the fact that Medicare is a public health system, and yet virtually every senior in the country who's immigration eligible depends on that system for healthcare. So these systems become ingrained, and over time they're just part of the background and part of the landscape, and it's sort of part of the social contract.
Yeah, that's a good point. Just update on Cecelia. I think there's still tech issues, so it's really disappointing. I know we can see her in the attendee list, but hopefully we'll be able to schedule a follow-up. So it'll be like an extra of the solution summit. I know it's really disappointing, but I think Alison.
Can I say one more thing, Natalie? I was just thinking about other ways for folks to get involved, which I didn't mention, but it's so critical. If some of you are Catalyst members, I know you work with Catalyst all the time on campaigns, and one thing that we can really be doing is just each of us reaching out to our own elected officials. I think this issue has really fallen down party lines, and it shouldn't be. Healthcare and the right to access healthcare should not be a partisan issue. It should be a basic human right. And so if you don't know where your legislator stands on this, look into that and let your state elected officials know this is something that matters to you. Their constituents want Medicaid expansion, and tell your neighbors to call them too.
Can you advise, and I have a couple of questions lined up for you, can you advise if folks want to know where does their legislator stand on the issue, where's the best place for them to go to get that information?
So, there's not really a report card on this issue, so to speak, but I think the best thing to do is to find your legislator. You can look up my Florida House. I can't remember what the Senate's website is offhand, but if you just Google Florida Senate and Florida House of Representatives, or if you Google who is my representative, you can find that information really quickly. And these people serve us. And so you can, and you really should. And it's not, I think, I remember the first time I ever called my elected official, I was really nervous about it. And I sort of thought, what are they going to think? I don't know what to say. But they get these calls day in and day out, dozens and dozens. They get emails nonstop. If you don't feel comfortable calling, you can email, and they really should respond to you. But if you pick up the phone and call the number for your state elected official, someone should answer on the other end, and you can just say to them, hi, I'm a constituent in the representative's district. Medicaid expansion really matters to me. I'd like to know, where does the representative stand on Medicaid expansion? And hopefully they'll give you an answer. And if they don't, you can say, well, I can call back in a couple weeks to follow up, but I want you to know that Medicaid expansion is really important to me. And if you have a story to tell them. I mean, like I said, our tax dollars are paying these people's salaries. It is their job to represent you. They can be voted in and they can be voted out. So they're there to serve their constituents, and you have a right to tell them what it is you want them to vote for.
That's great insight, and really helpful, specific instruction on how people can contribute. Allison, can you comment on, and this is a question I believe David Peary is asking, commenting on the role of community health centers. Yeah, Jesse tries, you know, the federally qualified health centers, but I'll bring it up a notch to just all the free clinics, FQHCs.
The role, does it say something specifically about the role or just in general?
David, I'm going to interpret for you, and I think potentially in expanding access generally. Generally, and then maybe if you can think of specific public policy. I know you, again, potentially like with the copay reductions or sort of where are partnership opportunities? What's the role?
Yeah, sure. So that's a great question. So I will say, you know, one thing we've really seen with COVID that it has laid bare how underfunded our public health system is. Year after year after year, governments cut public health budgets. It somehow seems like this isn't something we really need. We really need to be putting our money over here. And if we need to cut couple million, couple $100 million, we can take it out of public health. And we've seen with COVID what a disastrous decision that has been over the course of many years. And Florida has been cutting funding to public health year after year for the last decade. So one place to start is money. Those clinics need more money. They need to be funded appropriately because they are such a critical part of the safety net. And until we get Medicaid expansion, but even once we have Medicaid expansion, so many people rely on those clinics. They're convenient. They're where people live. They often have providers from the community. They speak people's languages. They're oftentimes some of the most culturally competent care you can find. And so it's really critical that we give them the resources that they need. And again, if and when we expand Medicaid, they will get more dollars through the reimbursement that they'll be able to get for services provided. But until then, they really need a bigger slice of the pie from state and federal budgets. And that's another thing, again, like if you're getting on the phone with your legislator, let them know, I just want you to know that, Jesse Trice Clinic is my clinic and me and my family rely on it. And we really want you to do everything within your power to support them. And I think, there was another thing I was just going to say, but I think really, unfortunately, what it comes down to for those clinics is they need to be adequately resourced.
Thanks, Allison. So I have an understanding that we're going to try to have Cecelia on a speakerphone. So I'm going to pause now so that we can try to hear from her for a little bit.
Good.
Can you all hear me?
Yes.
Oh, Natalie. Oh, Alison, you all have been wonderful. I've been watching. I've been backstage saying, yay, yay, yay. Everything they're saying is real. You all, my name is Cecelia Belser-Patton, and I live in Kansas City, Missouri. And we just expanded Medicaid in Missouri with our election in August of 2020 of this year. I was able to be on both sides of our campaign. So grabbing signatures, doing all the signatures that we needed to get on the ballot with all the other grassroots organizations here in Missouri. And so I want to stand here and be a point of encouragement of the power of the people is enough. No one ever thought that we would be able to expand this in Missouri. We've been trying to expand Medicaid since 2011 with no avail. Our government, our elected officials were saying no, no, no at every turn. And so we took things in our own hands. After we were not able to do so in 2016, we built grassroots momentum with different organizations and committed to gathering the signatures that we needed to gather in our state in order to put it on our ballot. We put it on our ballot and then we voted for it in August. So I was able to be on the side of gathering the signatures, working with all different types of coalitions all over the state, people that we would not normally work with as a grassroots, progressive, liberal organization, and doing that and realizing the power of joining forces, coming together and doing so. And I want to encourage you all to continue to do that in Florida as well. I agree with the things that Alison has talked about really making sure that those that we have entrusted to take care of us, those that are operating our small clinics, our hospitals, recognize that they have to put money in this on the other side too, once we gather the signatures, to really continue to push these campaigns through so that we can do what we know that we can do at the ballot box. And so, you know, it was long, it was hard. We worked on this for 2 years and we were successful. There were all types of tricks that our enemies tried to play. We thought that this was going to be on the November ballot, and in May, actually the end of May, the beginning of June, we found out that we had about 7 weeks in order to campaign furiously because we voted on it August the 5th. It is something that can happen. It can move forward. Do not give up, and please continue to do so. Work with organizations like Catalyst and Catalyst partners that they are working with in order to make this happen. We know that it can happen, and we just believe in you. And we believe in the power of the people. So any questions that you might have of how we did it, I'm here to answer. And so wish that you could see my face so you know how much I want to be there with you. Technology is great when it works. When it doesn't, it's just like what it is. But here we are. We still made some things work. So I'm here for questions if you have any.
And I'll wait for some to come in the chat box. Cecelia, I don't know if you can hear me live or if someone can text.
I can hear you, so everything is good.
It's like you're here. Cecelia, I think it'd be helpful. Can you share a little bit about the sort of political context of the state of Missouri, just so that, you know, here in Florida?
Absolutely.
Absolutely. Yeah. Can you?
Yep. So, Missouri is considered to be, it's what's called a trifecta. A trifecta means that we are as red can be. The only place that we have any blueness in our state are Kansas City, where I reside, in St. Louis, and a little bit in mid-Missouri, where the University of Missouri resides in Columbia, Missouri. And so we have a Republican governor, a Republican House, and a Republican Senate. And we are about 90% Republican in our state. Our state votes that way. We were able to shift voting in every county in Missouri. So while every county did not vote to expand Medicaid, we had enough of a percentage of an uptick of votes that were for Medicaid in each county that helped push us over the limit. We knew that we were going to do well in the Kansas City metropolitan area. That's over about 3.5 million people, and in the St. Louis metropolitan area, that is about the same. But we had to carry the entire state. And so we knew that it was an uphill battle. We also knew that if we were intentional about going across the state, building relationships in even the rural parts of the state, in places where people felt like this was a governmental handout as opposed to their right, we had to really educate folks. And so we had intentional outreach that even in the pandemic, where we were taking out Marv, which we bought a old medical ambulance, and we drove to every county in the state, and we shared this message. For you all that don't know, you can't see me, I'm Afro-Latina. And so it was very important for me to go into populations in our state that were Black, that were Latinx, and really give the information and move the information forward about why this was important. why this was important for everyone. It was also very instrumental for us to do this in our campaign with rural white folk who had been told erroneous information by the people in which they live and work and play with every day, that this was something that was for people who didn't deserve it, for ne'er-do-wells, for lazy folks, and not recognize that this has always been a safety net. Since its implementation on July 30th, because that's Medicaid and Medicare's birthday, July 30th of 1968, it has always been a safety net for people who need health care and health insurance. It is our right. It is our duty for us to do the things that we need to do to people who need to be taken care of, so that people don't have to make decisions about their utilities or their rent or their mortgage or putting food on their family's table as opposed to their health care. So that's our state in a nutshell.
Thanks, Cecelia. I have a question from David Tyson, who's with the University of Florida Shands, which is in North Florida. Question is, any suggestions for engaging health systems and hospitals? And sort of, if you want to share a little bit how in Missouri were hospitals and health systems involved in the campaign?
They were, and that's not normally who we're at the table with. So we had the Missouri Hospital Association that came to the table because they recognize the economic benefit of what this would be, as well as providing services for all that needed to be provided services for. So David, what I would say is to really to build coalition, to find people that are going to be your early adopters, that can be your influencers at those tables, other physicians, to find people that are part of your hospital associations there in Florida, to find your elected officials who know that this would be good for your state, and to start building coalition and momentum around that, to really be able to then charge those who have the resources to be able to help fund campaigns that like this that are needed to rally around. This will be something that is good for the state of Florida. So where you are in a university setting, how can you do that with your professors? How can you do that with future doctors? How can you do that with people in soft sciences that know the statistics of what has happened to states that have expanded Medicaid, the economic boom, as well as the wellness boom? Because what it does is it provides opportunity for people who have not been able to actively engage in democracy, to actively engage in their citizenship, to be able to do so because they're healthy, and not only physically healthy, but mentally and emotionally healthy as well.
Thank you, Cecelia. And I want to encourage, I hope a lot of you are planning to join us tomorrow at 1 p.m. because that'll be a more collaborative and open conversation on specific ways that we can try to make the case or for individuals who are interested to get together and talk about how to make the case to different stakeholders in healthcare. So we are at 1. I want to give Cecelia, I want to give you the opportunity to close out, and Alison also to make any final remarks. So Cecelia, any last comments?
I would say don't give up. I would say that is what people expect for us to do. I think people expect for us to just roll over and say, well, that's how it is and that's how it's going to always be. And I would say to please do the opposite. I would say to utilize all of the wherewithal that we have to research, to reach out, to encourage people to be a part of this fight, to utilize the shift in the momentum that we have in our country right now with a different administration, to think about all the different ways in which you can do this in a multi-tiered way, whether it's grassroots, grass tops, and everywhere in between. And reach out to us who have done it. We are here. We know how hard it is, and yet we know it can be done. And we encourage you with all of our faith and might and hope for you here in Missouri and other states. Oklahoma just did this too. And let us know how we can help. Let us know how we can be in partnership, and let us know what we can do.
Thanks, Cecelia. It's so encouraging. You are like a cup of coffee, an espresso shot to keep us motivated. Alison.
It makes me so thrilled to hear Cecelia, because yes, there is hope, and we have a really tremendous coalition of folks working on this in Florida, and seeing the chat with so much activity and so much enthusiasm and interest in getting involved. I think We're only going to keep growing this. Hopefully we win at the Supreme Court on the ballot initiative questions, so we can have that on the ballot in 2022. And even if we lose at the Supreme Court, we've got our work cut out for us, but we can still get it on the ballot in 2022. And we've also got, like I said, numerous bills in the legislature this session. So let your legislators know this matters to you. Get involved in your community. Reach out to us at Florida Health Justice Project, at Florida Voices for Health. Let us know how you want to be involved. We can give you suggestions, but there is room at the table for everyone. So thank you all for being with us.
Flood with letters, calls, do everything that you can do. Let them know that this is important to you and your family and your community.
Yes.
Yes. Thank you, Cecelia. All right. Well, it's not a conference unless we run a few minutes over. So thank you all for being here, for sticking with us. Please join us tomorrow at 1 p.m. for the brainstorming and strategizing session. And everyone have a great Friday. And thank you so, so much to Cecelia. You are an inspiration. And Alison, we are so lucky to have you here in the state of Florida. Thank you all so much.
Thank you.
Thank you.